The gentleman from Louisiana is recognized for 2 minutes.
I'd like to thank my good friend, Dr. Burgess, today, and I rise in support of H.R. 2. As a family physician who's been in private practice since 1982, I've seen a lot of things happen with Medicare. And this idea of sustained growth rate or sustainable growth rate, SGR, that came up in 1997, a Republican idea, is not only flawed, it's idiotic. It requires physicians to control throughout the country the entire volume of services that are provided, something that is absolutely impossible to do. It actually has had the opposite effect that was desired, and it's actually increased the amount of activity because of loss of the valuable economic foundations that are necessary to make a system work. Now, what this repeal of SGR will do is number one, it'll actually show what the cost of this is. We've been hiding it like a shell game for years with temporary patches that last, maybe a year, sometimes less. Not only will this balance or pay for itself in the second decade, but it actually begins to lower that cost even in the first decade. And it does it using several mechanisms, but two important reforms that my colleagues need to know about. Number one, it reforms Medigap policies, which give patients skin in the game. It makes patients once again a part of the decision team so that they, by having some element of price sensitivity, can work with a doctor to decide what is necessary and what is not, what is affordable and what is not. Also, it asked higher income seniors to do their share. Remember that the current Medicare system is a highly subsidized system for everybody, including Warren Buffett, a 40 billionaire, gets his health care subsidized. So I urge my colleagues to support this. This will increase patient care. Thank you, and I yield back.
Gentleman's time has expired.